On this episode of the Ask Mike Reinold Show, we talk about some recommendations for studying for the CSCS, how we explain the effect of cupping to our patients and some of our clients, and we go around the room and talk about what are some of our favorite pieces of equipment that we would recommend you to add to your gym. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're up at Champion PT and Performance. Again, the whole physical therapy, strength and conditioning crew is here for another awesome episode. It's amazing. So Kiefer Lammy, Mike Scaduto, Dan Pope, Dave Tilley. I'll come back to the students at the end. Nick Esposito, Christy Zermulin. No. Yes, I'm getting there. And Dewesh Pudel. Everybody is here. We are just rocking and rolling at Champion PT and Performance, answering your questions as usual. Let's have our awesome PT students take it away from here. Matt Bazardvark Birkenstock, Berserker, from the University of Utah. That's pretty good. And Hailstorm Haley Brinkman from the University of North Dakota, who has the first question for this episode.
I got it. Jenny from San Antonio. What resources do you recommend for studying for the CSCS exam?
Okay.
I thought you were going to say Jenny from the block.
Who's the last person to take the CSCS?
Might be me.
Right? When did you take it?
November.
Oh, okay, so November. You've taken it within the last couple of years, right? Anyone take a CSCS recently? Like,
been a while.
Yeah, been a while in there. All right, so what'd you guys do for your study?
I got the book they recommended, the big Essentials for Strength and Conditioning, and then I practiced programming my own workouts. So I took the concepts I was learning in the book and put it into my own workouts, and then also writing things for like friends and like, hey, I think you could do this based on what I just read. So I'm someone who really likes to apply what I just learned to make it permanent.
Nice. Okay. All right. I like that. So the book. The book was your big one.
Just the book. I didn't use any of the resources.
The book was your big one, then try to apply it clinically.
Correct.
I like that. So the NSCA has their own textbook, which is pretty awesome, right? It's kind of like telling you what's on the test, right? So that's pretty much it. It's a big book, though, right? It's dense, it's big, it's girthy, right? So what'd you do, Dave?
I read the book once.
You probably took it to the nth degree.
Not really.
He rewrote the books in the morning.
I read.
He rewrote all the errors. And then,
these chapters need some work now. I read the book once, and then I shadowed a bunch of friends of mine and then in here who were strength coaches, and then took a practice test, and the things that I bombed, I read those chapters again.
Where'd you get the practice test from?
It was on like, or the back of the chapter things.
Yeah,
yeah.
I think they sell them on the NSCA website.
So I took a practice test, and then things that there's just like random stuff that I just didn't have, because I'd taken the sports boards, and there's a lot of stuff that was definitely not covered in the sports boards that I like really did poorly with, like nutrition, like calculations, like body weight calculations wasn't even like anywhere on the sports board. So whatever things I did really poorly on, I read those chapters, and I did okay.
I like that. It's pretty good. I feel like the NSCA has like an online course, I believe now too, right?
Yeah, I did not do.
So they have the book, right? And there's obviously some good practical things you can do. But I'm pretty sure they have an online course, which kind of helps you a little bit too. So I'd go straight to the source. That would be my advice, right? The NSCA is going to tell you exactly what's on the test. So if you're studying for your CSCS, go to their website. Definitely the book. That's the no-brainer. You have to know the book. The question is, do you also want to do their practice exams in their online course? But man, I'm pretty sure they're giving you all the resources there. So I would do that. So nice.
Pretty reasonable.
What else? What's next?
We got Benny Biceps from left field at Fenway.
Benny Biceps from
Hope submit the question.
Yeah. Guys are getting creative. I don't know. This is pretty good. I think we're definitely going to probably pick your question if we have it more interactive. So what's Benny Biceps say?
All right. I am a new grad, and I've started to incorporate cupping into my practice for pain modulation. I tell patients that some people respond better to different mechanical stimuli. What are your thoughts on the use of cupping and this rationale?
Cupping. Dan Pope, I feel like this is a good one for you.
Combo cups.
Cupping. Dan Pope. Well, I think the question isn't necessarily about cupping. Even he said he uses it for, Benny Biceps says he uses it for pain modulation. So I guess maybe the question is, how do we explain it to people? And then maybe from the strength coach perspective, what do we do for self-myofascial release? Like how do we sell it or whatever, explain it to the person? Because I think there's a lot of criticisms even on self-myofascial release that we're not releasing fascia, right? So I think as a profession I think we all get that at this point. It's all about
Self-pain modulation doesn't roll off the tongue as
yeah,
well.
it's a self-pain modulation sound. You're breaking all our rules of interacting with people, right? But Dan, what do you do? How do you explain cupping to people?
Well, I tend to bucket like soft tissue techniques into one general bucket. I mean, we're trying to improve. Yeah, exactly what I'm doing. So I'm probably trying to increase range of motion or decrease pain, right? And I think it depends on the person and it also depends on the body part, right? We do a lot of lats here, we work on a lot of shoulders. I'm not going to take a tool and just go right down someone's rib cage. That's not going to go well. So in that area, cups work really well.
Tried that?
Hands work.
I feel like you tried.
Yeah, I go for it, man. Some people love it. And then also it really depends on the individual and patient expectation. I think if we look at some of the research, there's lots of research to show that it depends on what that patient wants, what they expect, what they think works the best. I ask patients that all the time. What do you like the best? What do you think is really helping you? And they'll say, oh, I love the cupping, or I love this, and I do more of that. You know, as long as it's doing what we want, so getting the patient better, reducing pain, improving range of motion. That's how I go about it. But I can't specifically say like, okay, I feel this area and it's a little more dense here, so I got to use the cup. I don't apply it that way. That's generally how I go about it.
And I think that's fine, right? It's just all about how we explain it to the patient, right? So, you know, I think you did that. What else? Anybody have anything to add to that with cupping? I mean, what do you guys do? I mean, for me, I just explain it as, look, it's just another way that, we have mechanical, mechanical input to the body, right? It's another way we do it. We use our hands, we use tools, we have cupping. And one thing I do say about cupping, and I do kind of point to a little bit, is cupping does combine both compression and distraction of the skin. I don't know what that means. I don't know if that does anything, right? But it actually, we used to say that, like, look, we have like instrument-assisted soft tissue with our hands, and it's like push, push, push. So like foam rolling, lacrosse balls, push, push, push. And the cup sucks, right? It pulls up a little bit, so you get this traction.
Ow.
Fiber.
It's my arm hair.
It's not a cup.
That's why we use the cup.
So you have this like traction of the tissue, just a different way of doing it. But we've actually shown now that with cupping, you get compression around the rim. Right? So you get compression around the rim and then distraction in the middle of the cup. It's actually a pretty cool combination of different inputs, right? So I think we just explained it in that, but then we always say, and I think I always add this, well, look, people feel better and move better afterwards. So just let me know what you think. Let me know how you like it. We don't say it's solving anything. And I think that's, a good approach, right? Just kind of start right there. Because trust me, any theory that you think you're going to come up with right now, I guarantee you will be different in 5 years. Anything, if it's related to pain science, biomechanical stuff, we are going to have a different theory in 5 years. So let's just say we don't know sometimes, and just say it's a different input to the body, and it's designed to help you feel and move better, right? So what do you do for self-myofascial release? Anyone want to jump in, coach-wise?
Yeah, I mean, there's foam rollers, there's lacrosse balls, there's different density balls, there's a lot of different stuff, and I think a lot of times people forget about like breathing once they find like a really dense area, and which kind of can help release that area or something along those lines. Some people just kind of roll on something for 5 minutes just because it makes them feel a little bit better that they did something. So I think it just goes on to the person and whether it improves their movement quality and whether it improves that mentally. That's another side of it too.
Yeah, no, I great concept on the mental component, right? Do you feel better afterwards? Do you get a better workout afterwards, right? So awesome, that's good. I like it. What else? We got one more question, right? Yeah. We got one more.
We have Mike from Indiana. What are your top 5 pieces of performance equipment that you recommend for ortho sports clinics to have in their gym?
Top 5. Whoa. Why don't we go around again and we'll do one. Top 5 pieces of equipment in a gym. And it sounds like it's coming from the PT perspective, like maybe they're adding a gym to their physical therapy thing. So this is really pretty cool for like the coaches to jump in and say like, what do you guys think? And I'll assume that like Kiefer, before you say barbell, and like we're all like, let's try to be not necessarily creative, but like kind of talk about. But Dewey, you want to start it over here, or you want to pass?
I think just like a good sort of setup to start loading clients that might be transferring from, say, like a physical therapy aspect to something along the lines of like sports performance, or getting back to being like functionally active again, to like a squat rack or something like that. So just somewhere where you can get loading into that person.
I like it. Okay, so that's good. Maybe we'll put this all together at the end. I like that. So the ability to load, which is probably a squat rack, barbell, some dumbbells, that sort of stuff. Good. Chrissy, what's your number 1 piece of equipment? This is where everybody's bias comes in.
I was just going to say that.
Like a soccer ball. A soccer ball.
I won't say a soccer ball.
Double track, TRX.
No, people are probably going to hate on me for this, but I would say, just with my obsession with like energy systems and conditioning, I would say a Woodway treadmill.
Okay.
Because I think that is important whether you like to run or not. that people have the ability to do it.
Okay.
I think people move better, like just in life, if they have that ability to run and sprint and do all those things. So I think that, you know, whether people have the goal of running or not, like whether it's just getting back functionally, like it's important to be able to do that. And I think that's a great tool to get people
I like it.
in a good position.
Why the Woodway specifically? So obviously we have a Woodway curve treadmill here, but
I've tried a few different
Yeah.
treadmills, and I just think that one puts people in the best position.
right, and it's a self-propelled kind of one. So yeah, what I'm getting at is you like the self-propelled
Yeah,
concept. It
for
sounds
sure,
like.
as opposed to just
I like
track
that.
running with
So
you.
good. So something that is self-regulated. And there's probably a better word for that, right? But like where you provide the the output, the input provides the output. I guess the harder you go, the harder it goes. I think is good. So loading and some energy system stuff. What do you got, Nick?
I'd probably say kettlebells. I think a kettlebell is a very versatile piece of equipment. You can swing it, you can deadlift it, you can lunge it, you can carry it. You can, yeah, I know, it's like an implement.
Spin it.
I can't wait for the audio to spike with that one. That's gonna be good.
Poor audio engineer's like, ah!
There is juggling to it.
Yeah.
You can't juggle them.
My tone.
We've had people try to juggle with the
tone, yeah,
kettlebell,
my tone.
unfortunately. I like that. So kettlebell, which is a lot of versatility of that. So again, you're opening up a gym here. Have the ability to load energy systems, some different different types of loading with kettlebells, which give you different just different things you can do with them. I like that. I think I would add a thermostat, right? A thermostat, so that way we can control the temperature in the gym, which we've struggled with lately here. So. Geez, I don't know. That's of a piece of equipment. I mean, one thing that that we've set up here that I think offers some versatility is to be able to have attachment points for things somewhere. So for us, we have a bunch of different things because we have this blend of PT and fitness in here. But on our rigs, there's lots of places that you can attach bands, sport cords, it's something for like a lateral hop or those types of things. So to have some fixation points somewhere, whether it be in your rack and your rig, we have some things that we built into our cinder block wall where you can kind of attach things there. It just adds a good amount of versatility of what you do. I would definitely recommend you try to build some of that into your gym.
Yeah, mine's a little bit of an odd one too, but kind of off that is honestly mine's just a little bit of space. I think that I worked in as a student, I was in a very confined clinic sometimes, and I was like, oh god, I just want to run a little bit or not worry about hitting a ceiling. So having a facility with a little more room, which is you can open up the end of rehab to be actually sprint based or actually throw a med ball as far as you can. So I think
don't have to jam everything in a small spot.
For sure. So mine's just not a ridiculous amount of space, but just 30 feet of running space or agility work and a little bit of the higher ceiling.
Yeah, you'll use it for sure. Pope, what do you think?
So I'm mad because that was mine. I think that's huge though. I mean, a lot of clinics are tiny, and then you want to get your athletes back to running, jumping, changing direction. If you don't have space, you can't do any of that. I'm going to say maybe a concrete wall with some med balls.
Ooh, nice
to
one.
work on some power. End stage, rehab, sports, a lot of times you have throwing athletes, not just running, jumping, change of direction athletes. So you're going to have to be able to do something similar. And you can throw balls against the wall, you can throw stuff against the wall, and sometimes get that drained effect. So
I love walls. Awesome. It's a pretty wide camera angle, wide camera lens there, so that was Dave's butt. Trying to go underneath. That definitely showed up on camera. What do you got, Mike?
Definitely need a golf simulator.
Golf simulator,
Definitely
yes.
need one.
Something we do have a champion here for personal/commercial use.
No, but for real, I think a sled is a big bag for your buck one. You can work on speed work, sprinting mechanics, energy system works, getting stronger. I think sled, I use a lot of sleds for myself, and I try to use them with patients. So
I like that. Good one there. Kiefer, this is
still got one.
Yeah, I was gonna say it's hard to get
Should
that.
I say jerk blocks?
Dumbbells?
Do you want me to say jerk blocks? I think I'm gonna say landmine. I think the landmine's super versatile, not just for pressing to kind of modify overhead work, but it works really well for squatting and hinging movements to kind of, I feel like it's something that you can adjust your position for just about anybody's body type or for what they need at the time.
Yeah, I would agree with that too. I think a landmine's a good one. So good stuff. So loaded energy systems, versatility with the kettlebell, attach things to things, a tumble track. What is it? Space. Oh, space, right, yeah, space. And space, more space, a concrete wall, sleds, and Kiefer, what was your last one?
Landmine.
And a landmine. I mean, that's actually some pretty good advice, especially if you're, from the clinician side. It's about getting some of these like this functional equipment stuff. So when in doubt, just flip through the Perform Better catalog and just order everything. It'll be perfect. So.
I'm pretty sure we just aimed at our entire gym.
Yeah, pretty much. That was good. So awesome. Great job. Good job, guys, with the questions. I like it. Head to MikeReinold.com, click on that podcast link, and you guys can ask us questions. Anything you guys want to talk about, we'll answer. We appreciate everything. Head to iTunes, Spotify, rate, review, and subscribe, and we'll see you guys on the next episode.